Okay, it's live. Okay, I'll just it from.
Ma'am, 1 more minute, ma'am. Let it be 100%.
Okay. It's happening. Okay.
Hello.
Okay.
Can you hear me okay?
Yeah.
Okay, good. Hi, Jill. Try again.
Let's try.
Let's start.
A very good evening to honorable guest speakers, chairpersons, dear members of Indian Academy for Clinical and Dental Genetics, ladies and gentlemen. I, Dr. Udita Singh, seek utmost pleasure in being your hostess for today's event, and I welcome you all to this wonderful, beautiful evening, wherein we have gathered today to explore the exciting universe of saliva technologies and its applications.
Udita, I'm sorry to interrupt you. I think you are live on YouTube, so you just need to switch off the volume of the YouTube that's live streaming. Okay, fine. Please go ahead because your voice is echoing. It's okay.
She's on mute. She's got her microphone muted.
Unmute yourself.
And proceed now.
Yeah.
But whatever I'm speaking, that is being repeated after some time.
Yes.
And I'm not live on YouTube from phone or anything.
Okay. Okay, no problem. Maybe we mute ourselves. You continue. Then when we speak, we will.
Yeah, good idea.
Hope it works. Apologies for inconvenience. I hope it's working. I'll check once again, ma'am, what's happening.
Please carry on, Udita. No problem. We are already late.
Hmm.
You can just put your phone's volume.
Ma'am, I'm not live from my phone. I have not logged in. It's switched off. I don't know what's happening.
It's okay. Please go ahead.
I
No problem.
switched off before logging in only.
Okay.
Apologies. Then, before we begin anything auspicious, we always offer our prayers to Almighty God. So let's get together and offer sincere prayers to God to be kind to us, and we may finish our today's tasks to the best of our abilities. It is a matter of extreme honor for me to welcome and introduce the esteemed world-renowned speakers for today. These people, they are pioneers in the field of saliva technology, and it's a huge matter of honor for us. We are indeed obliged by this act of theirs that they have spared time out of their busy schedule to be with us this evening. Thank you, sir. Thank you, ma'am. With immense pleasure, I now welcome and introduce Dr. Paul D. Sloy. Sir is a PhD and CEO of Oasis Diagnostic Corporation. Sir is a co-founder and organizer of North America Saliva Symposium. He is Honorable Professor at Central South University, China. Thank you, sir, for being with us.
Thank you so much for having me. I'm looking forward to this very much.
Thank you. With immense happiness, I now welcome and introduce Dr. Jill L. Marin, ma'am. She is MD, MPH, and Vice Chair of Pediatric Research, Floating Hospital for Children. Ma'am is an Executive Director at Mother Infant Research Institute, Tufts Medical Center. She is Professor of Pediatrics at Division of Newborn Medicine. Thank you so much, ma'am, for accepting our invitation.
It is a real honor and pleasure for me to be here. Thanks for having me.
Thank you, ma'am. Now I present before you Dr. Gargi Roy Goswami, ma'am, who is founder and director of Indian Academy for Clinical and Dental Genetics. This academy is first of its kind endeavor in India to bridge the present gap between the understanding of clinical science and basic sciences by inculcating interdisciplinary scientific knowledge among healthcare professionals. This academy is her brainchild with a motto to create, collaborate, and contribute towards useful and positive science. I request Dr. Gargi ma'am to kindly say a few words.
Thank you, Udita, for giving me this opportunity to speak. Well, today is a very great day for me because today I am sharing a platform with my mentors, not only my mentors, but uh, very avid researchers and people whom I have been following from long years. So, a little bit on saliva diagnostics or bringing it to India. I will not take much time because I think we are here to today for hearing from Dr. Paul and Dr. Marin more. So saliva diagnostics, let me just tell you that it is not new in India. That is the first thing I should say. And if you see the genomic boom that has happened in the last few years, actually have relied on saliva as the most trustworthy sample. Also, if we see like various saliva studies, particularly that have been happening in the dental fraternity for quite some time, only thing which I personally observed is lack of interdisciplinary or multidisciplinary approach or coordination rather, so moreover, the translation of research, that is the lab bench to the chair side, that is also quite a bit lacking as far as my observation is. And particularly when it comes to dental research, that is the one area which I have been focusing. So I love to talk on that. And like although dentists deal with saliva every day, to be very honest, is its importance has not been realized much. So I accept there are challenges. Well, in every field there is challenges. So I felt that saliva is one of the best tools, at least for dental fraternity, to look upon as a friend and not foe. So to materialize that vision, I initiated Indian Academy for Clinical and Dental Genetics. First of all, to make people aware at the first hand what wonders science has to offer through these biological, I mean, magic fluid, I should say. And also, like if we are talking about genetics, genomics, or any other knowledge per se, saliva gives us an opportunity to apply all these fine technology or finer technologies to bring out new innovations that can be used for the welfare of mankind as well as to serve the society. So my motto is very simple: create, collaborate, and contribute to science.
Thank you, ma'am, for your insights. An age old saying goes by that eyes only know what the brain knows. And today's scientific event is a humble step in expanding our existing understanding about the field of saliva and its role both in diagnostics and therapeutics. As most of us are already aware that saliva is a unique body fluid that has a promising role in the molecular diagnostics, as it contains not only components found in serum but also offers various advantages, like its collection is easy and safe, it is a pain-free method, it is non-invasive, and it is also cost-effective. So let us now hear the valuable insights from the subject experts on this matter. I now request Dr. Jill and Dr. Paul to kindly enlighten the audience about the importance of saliva diagnostics.
Jill, would you like to take this one? I think your population is probably the most important. I have some ideas, but I think Dr. Marin has the most important population, the very vulnerable population that obviously benefits from having the saliva sample. I can add some comments after Dr. Marin has said her little piece, I think.
Okay, I think that'll be fine, Paul. So for the audience, I'm a neonatologist by training, so I take care of very, very small babies, and that has always presented a unique challenge to me on several fronts. The first is our ability to communicate with them. This is a patient population that clearly cannot tell me how they're feeling, what hurts, what's going on, and they're rapidly developing. They're so tiny, they also have very small blood volumes. And so the concept that I could use blood repeatedly on them, stick them with needles if I don't have direct access, and certainly trying to engage parents to enroll in clinical trials or research studies was a huge barrier for me. But what we learned, well over a decade was if I could take even the smallest drops of saliva from these babies, there was a wealth of information that was attainable. Dr. Gargi mentioned about genomics, and certainly their DNA is readily accessible, but beyond that, their RNA or gene expression and their protein expression is available as well. And we've been able to utilize saliva in this population very non-invasively, importantly serially, as they're developing in real time. And we've been able to garner a lot of information about both good development as well as aberrant development that may suggest that there's a problem with those babies. So for me, this is a biofluid that is extremely important and valuable as I assess, understand, and try to study this population. Parents are more than willing to accept our ability to enroll them in clinical trials, which is extremely important. And it's been shocking to me, and I think to some colleagues over time, just how much we can learn from saliva, and we're not limited from it. And I think we'll delve a little bit into that later on when we tackle saliva versus blood as well.
Yeah, I think what I'd like to add to that is, saliva allows you to do remote collection or remote testing even. We have instances in the United States where devices will be sent into a home and the patient will self-collect the specimen. It doesn't necessarily have to be point of care where you get the results immediately, but you can take that sample. It's very easy for the patient to collect it themselves. They don't have any pain. I actually talked to some of the people that do the self-collections, and they're so happy to be able to use a saliva sample, because in the past they've had to draw blood from themselves. So this is obviously important. the point of care market requires something that's done immediately. And, you know, some of the tests that are done use serum or blood, which is obviously invasive. Even a finger prick test. I used to finger prick myself to run an HIV test all the time. I ended up with big holes in my fingers. It was very painful. So even, you know, alleviating the pain of doing those particular tests is you know, important. But I think, as Dr. Singh mentioned earlier, it's cost effective. You don't have to dispose of it like you dispose of a blood sample. You can transport it easily, and it is cost effective. And, you know, it's the preferred specimen after all. The only negative side, of course, we've got is that sometimes the levels of biomarkers in saliva are much lower than they are in blood. So we have to find very sensitive methods to find those biomarkers. But that's not a limitation as much as it used to be.
Thank you. Your explanation will surely motivate many of the researchers to start with the field of saliva. So the next question I would love to ask is, what are the important biomarkers in saliva that we can start with as a saliva researcher?
You want me to take that one, Jill?
Yeah, you can start and then I'll add my thoughts on it, Paul.
Yeah, I'll probably cover what you do. I know what you do, but you know, there are, yeah, I would say I've been in saliva diagnostics for 24 years now with 3 different companies. And, you know, I started my company 18 years ago. And at the time, there was very few things that were done in saliva, mainly because there was no standardized tools to be able to collect saliva, for the first thing. And then, you know, finding those biomarkers with the technologies they had 24 years ago was difficult. You know, didn't have mass spectrometry. We didn't have, you know, fluorescent lateral flow. We didn't have next generation sequencing and technologies that go down to very low levels. So now we've got those technologies. You can basically look at anything in saliva. And when somebody tells me that that's not true, I challenge them every time. So things that you can look at, for instance, are cortisol, which is, you know, a stress biomarker. It's looked at routinely. It's probably one of the most important biomarkers in the field. C-reactive protein, which is, I know that Dr. Marin herself looks at CRP in babies, you know, for specific information, and she can talk a little bit to that. But, you know, switching to the genetic side, you've got pharmacogenetics, which work very, very well with saliva. We've, you know, many researchers have shown that you can actually take a saliva specimen, collect the DNA from that, isolate DNA. In fact, sometimes you don't even have to isolate the DNA from the saliva sample. You can go directly to the downstream reaction, which might be a pharmacogenomic test that tells you whether a patient is susceptible to that particular drug or is going to respond well to that drug. Hereditary diseases, just about any genetic test. Cancer is becoming really important. You know, it's been discovered recently that you can find cell-free fractions in saliva, cell-free DNA, cell-free RNA, and Dr. David Wong's work, which most people on the phone will probably be familiar with, it looks at lung cancer, particularly in, you know, cell-free samples, and they're able to diagnose lung cancer in 30 minutes, which is revolutionary. The other thing is hormones. For a long time, hormones have been looked at in saliva, and in saliva, hormones actually are expressed as the free form, which is the most important form. In blood, you get the complex form, which leads to some erroneous results. So saliva is typically a better medium for cortisol. And you know, we have people looking at Alzheimer's disease and Parkinson's disease in saliva. So it's basically across the board. I think it's become a much more important biofluid.
And if I could just add to Paul, one of the things I've really learned in my career in saliva is there's a difference when we go for what I call known biomarkers and then biomarkers for discovery for a disease state. And we're able to do both. So as Paul mentioned, cytokines, cortisol, hormones, certainly they're all present in saliva. And when you develop an assay and you know exactly what you're looking for, you can do that. But we're not limited by what we know. We can also explore saliva for areas that we don't know. So comparative analysis between patients who suffer from a disease state and not, and use some of our more global hypothesis discovery platforms like sequencing, where you're really broadening the net of saying, well, I'm not really sure what biomarker I want in saliva, but by a comparative analysis, I might find something novel. I might find something that isn't in blood, but yet is highly informative in saliva. And from there, I can develop a new testing assay that has biomarkers that we've never known about or discussed. And these are two very different approaches. I will say that when you're doing biomarker discovery, sometimes that's a lot harder. I don't need to sell the clinical community on a cytokine panel. They know what cytokines do. They're familiar with them. I don't need to tell them about cortisol. But if I tell them, hey, I found these amazing genes no one's ever seen before in saliva, and I think they're correlated to a disease state, that takes a lot longer to really integrate and to get the community to buy in, but we certainly are able to do that, and we're not limited just by what is known. We certainly can explore this biofluid for unknowns.
Can I add a little, another comment? You just sort of twigged my imagination there. We did some work a long time ago with Austrian Institute of Technology. They're a saliva institute. They're a government institute, but some of the work that they did was really interesting. And what they did was they looked at blood-based microRNA biomarkers. Obviously, microRNAs, messenger RNA is kind of the new generation of tests that are coming to market. But they found that in blood, you would find certain microRNA markers that were indicative of a specific disease. And then they looked at the saliva profile and they found that these biomarkers were not in the saliva, but there were specific microRNAs that were in the saliva that were not in the blood. So what they concluded from that, and the work is still ongoing, is that maybe there are specific biomarkers in saliva that would be indicative of diseases that would never be found in blood, and vice versa. So, you know, in 50% of the cases, there's going to be an advantage to developing a saliva test for, you know, perhaps microRNA 121, which is implicated in Alzheimer's disease. You know, the other thing I thought about is the growing market for exosomes. You know, there's a number of companies working in exosomes. Exosome Diagnostics is a company that works specifically in exosomes, but salivary exosomes are, you know, there's actually a lot more information can be found from exosomes, and I believe a lot of David Wong's work is actually founded on the exosomal fractions, and it's a fantastic medium, and it's only just been explored. And I think, you know, if you're a researcher trying to look to get into some new market, exosomes is an area to look at. What I'd like to know, and I don't know this, and I don't know if anybody knows this, is we've looked at normal exosomes in saliva, but never looked at diseased exosomes. What I want to know is there a difference between somebody who has Alzheimer's disease, for instance, and somebody who's a normal, healthy individual in the exosome? Can we use saliva to determine differences between those two populations? It's very exciting, in my opinion.
Yes, indeed, very exciting and fascinating. So the next question I would like to ask is, how does saliva compete with blood?
Is that the one you wanted me to do, Jill?
Well, no, I like this one, actually. I think it's
okay,
really
very good.
and I think this touches a little bit on what I talked about before. Often I'm asked to do a comparative analysis between levels in saliva and levels in blood. And I have a couple thoughts on that. If I'm trying to develop an assay that I want to sort of supplant a blood-based assay, but the blood-based assay has been validated, I have a lot of work to do. I must show that what I'm seeing in saliva is as accurate as blood, potentially more accurate or less, whatever the case may be. But when we go back to what I was talking about biomarker discovery and either genes or proteins that have not really been explored in blood, my obligation is very different, because I'm not asking the question, how does saliva compare to blood? I'm asking the question, can saliva be diagnostic or helpful in this situation? So the obligation to compare to blood only really exists if what you're trying to do is say, I no longer need to do a validated blood test. I can do it better in saliva. And of course, you need a comparative analysis. Glucose would be an easy thing for us to understand. We all know we prick our finger and we can get a glucose level. If I'm going to tell the diabetic community that I can do the same in saliva, I have a lot of work to do and a lot of validation. But if what I'm trying to do is see how diabetes is progressing and I have novel biomarkers that I found in saliva, my obligation therefore doesn't need to be in blood or a comparative analysis in blood. In babies, we've done these comparisons, most notably with CRP. We do find they mirror concentrations are not the same, but we certainly see a correlation in the trends of CRP and in blood and saliva, and that CRP in saliva is also independently related to clinical course, meaning infection. So we know some of these biomarkers in saliva do correlate and are informative. But our field really isn't asking how do we compare with blood. Our field is asking the question is, can saliva make the diagnosis or not, independent of blood? And the assumption is always blood's the gold standard. And I'm not sure that's true, particularly for certain biomarkers. And this assumption is sort of buried deep in our head that, well, if it's in blood, it must be better. And I think we need to break the mold there, because that very well may not be true.
No, I want to sort of jump on that, because I think you're exactly right. The older generation, particularly, you know, and that would be my generation, certainly believes in blood being the gold standard. And, you know, if you're going to show me that saliva is better, then you're going to have to show me better data. So there is an education process that's got to be done before, you know, it's just going to be launched mainstream. And I think the COVID situation has actually helped a little bit. You know, I have to say that the younger generation, you know, the 20s and the 30s, they basically get saliva. It's, at least that's what I found. You know, you tell them that, you know, you've got a saliva test for something, and then they jump on it right away. You know, but it's the 60s, 70s generation that says, no, I've been using blood since I was, you know, 23, and I'm going to stick with blood. You know, and I think that's something that we have to overcome, but we are slowly overcoming that.
I think very correctly said, Mr. Paul. Actually, it's the mindset. The attitude has to be changed. How we see towards the disease, or like as ma'am also said, that it is not about always comparing what's there in blood and saliva. It's mainly that how we can take saliva ahead, and whether we will be able to do the same thing in saliva, or more finding out more novel biomarkers in saliva. So that attitude needs to be changed.
Yeah. The thing that I find interesting is, you know, I follow the literature. I look for companies that are developing new technologies, just because that's an interest I have. But you will find in the literature, like, just give you an example. Let's say Qiagen gets a $5 million grant to develop a blood test for such and such, but it never says saliva test. It's always blood test. Even these corporate giants think blood first. So we have to get these guys over the hump as well. It's not just the you know, the rank and file, the doctor or the dentist. It's really the big companies. Once they have a mindset like that, you know, I think I remember, and I think in my presentation last year or the year before at Salsi, I mentioned that these companies develop isolation kits for DNA from various bodily fluids.
Absolutely.
Right? So they've got a kit for blood, they've got a kit for tissue, they got one for urine, but they don't have one for saliva. So that obviously shows that they don't think saliva. They're always thinking about these other fluids. But, you know, maybe it's changing. We'll see. We'll see.
Very true. And listening to the valuable insights and the way that you people are speaking on this topic, I'm strongly hopeful that the young researchers among the audience will surely take up this case, and this will go a long way in creating awareness.
They will. They will.
Then, Dr. Paul, owing to your long association with the field of saliva, I would request you to kindly enlighten us what various tests can be done from saliva.
Okay, so as I mentioned earlier, it's a lot more than it used to be, mainly because the technologies that are available to detect those biomarkers are there. But we talk to people on a daily basis that they're running hormone tests, they're running tests for drugs of abuse, multiple panels of drugs of abuse, pain biomarkers, cardiovascular disease biomarkers, concussion. Their malaria, for instance, is a new biomarker in malaria that's been detected that can be found in saliva. Pharmacogenomic testing, all sorts of genetic testing for microRNAs, testing for either hereditary diseases. What else? Cancer, Alzheimer's disease. We have companies out there that you know, when we set up our own meeting, which is the North American Saliva Symposium that Dr. Marin founded in 2014, you know, we have people that come and talk about their test that they're developing for Alzheimer's disease. Another company is developing a test for Parkinson's disease that might look at a biomarker called alpha-synuclein or something like that. So there really isn't a limitation on what you can, you know, what you can identify. You know, there are tests for testosterone that are in development. There are tests for multiple biomarkers, multiple steroid hormone biomarkers that are available. So, you know, if anybody's interested, you know, we have some book chapters that best be talked to some of the applications that are available for saliva as well. And I think Dr. Gargi Roy has access to those. So, you know, she can forward them to anybody interested.
Absolutely.
But it's quite a broad array of different things that you can look for.
I think I will just add one thing here. Like what fascinates me is one slide, or whenever I see the composition of saliva, I feel that, you know, we can play with this biofluid. We can do anything with this. Is only that we are not taking it up, or maybe it's just the time. When the correct time comes, slowly people will get into. And if you see the composition, I mean. Starting from antimicrobial entities, ions, even dissolved gases. I mean, I think we can really do wonders if we really start looking at saliva in the way it should be looked at. Yeah.
Agreed.
Yeah, and if I just also add to it, because I agree, saliva is this unique biofluid that is a rich source of so many things. And that is something that offers so many opportunities. But from a technical standpoint, it can offer challenges. And one of the things I think we sit at a critical moment for our field is the due diligence that must be put into understanding how these biomarkers truly can be utilized. And I'll just briefly use as an example the microbes in the mouth. It's great they're in the mouth. We can learn an enormous amount because they're sitting in saliva. But if you don't understand the technology behind the platforms you are using, those microbes will disrupt your data and potentially lead you down a rabbit hole in the wrong direction. So we must study the science. We must understand the platforms that we're using and know how we could separate out, for example, the microbes from the human, the analytes from other. And sometimes when they're all together, they're going to interfere with the accuracy and the ability of the platform to quantify. And that's really where we have to understand what we're using, what we're looking at. And that is the only way we're going to really bring this forward. If we get lazy, if we don't do the science, if we don't do the due diligence, then we are going to really shoot ourselves in the foot and not be able to bring forward, because the clinicians and the patients won't trust it.
And the other thing, Jill, and you and I have talked about this at the last NAS meeting, was standardization of collection methodologies. Time to collect the sample, what type of sample to collect, what devices to use, all those things need to be standardized, you know, for different biomarkers. I mean, I heard recently, I think maybe it was more than a year ago, that even microRNAs are dependent on when you take them. Like for cortisol, you get a cortisol awakening response first thing in the morning. So that's the best time to take a cortisol sample, and it changes. You've got a circadian rhythm throughout the day. I heard somebody say that RNAs might be similar. So if that's the case, you know, we have to standardize when we're going to do it. So that's maybe something we as a team should focus on, is actually trying to standardize those things moving forward.
These are really valuable tips to be kept in mind before planning any research. So, sir, I would like to ask, is saliva really a good choice when it comes to chairside diagnostics?
So because we're talking mainly to an audience of dentists, I'll kind of stick to the dentist. And it's really a very strange situation, because we work with many dentists, you know, and companies that are in the saliva world obviously work with a lot of dentists. We go to the American Association of Dental Research meeting every year, and we talk to dentists, and they all talk about having chairside tests. And we have a number of collaborators, and Dr. Marin has as well, that are dentists. Dr. Wong's a dentist. Dr. Walter Sakura at the University of Saskatchewan just became the Dean of Dentistry there. Dr. Charlie Streckfuss at where's he at now? Houston. They're all, you know, practicing dentists still, and they all have, you know, patients to see. Their technologies though are focused on, yeah, the non-point of care aspects, if you like. There's a gentleman at Vegas. I've forgotten his second name. Jeff. Do you remember, Jill?
I can't
Jeff,
remember, but I know who you're talking about. I'm
yeah,
sorry.
he's actually focused on looking at periodontal disease for the dental office. But you know, I'm like everybody else. I go to the dentist twice a year, and when I go to the dentist and she's not playing around in my mouth, I'm actually talking to her about salivary diagnostics and what her interest is, and she's very, very keen to have things like that. And she's one of the forward-thinking dentists. And you find that there are some forward-thinking dentists, but there are also a lot of negatively thinking dentists that don't believe that. I think if we can prove that the dentist perhaps can make profit. I mean, I'm not a money talking person, but I think if we can show them that they can actually make a profit by doing a test for, say, dental caries or periodontitis in the dental office, right there, maybe when the patient comes in to do a quick test, they clean their teeth and then they give them the test results before they leave. I think that could change the whole paradigm. The problem is at this point, there aren't many tests that are out there. There are companies developing caries tests, there are companies developing perio tests, but most of them are lab-based. Our friends at Oral DNA Labs, for instance, they have a collection that's done in the dentist, but then it's sent away and you get your results several days later. That really hasn't caught on in large numbers either. So I really think we need a point of care application that will really set the dentist off, caries or perio or something like that.
Thank
Oral
you.
HPV is another one, perhaps, something like that. Yeah.
Thank you. Dr. Gargi, ma'am, ma'am, would you please throw some light on the present scenario of saliva diagnostics or research with respect to Indian dentistry?
Okay, so I mean, at present, as I mentioned before also, like saliva diagnostics is doing pretty well. Well, if I talk about dentistry, you will see, like Udita, you are a oral medicine and radiology specialist. You are a faculty also. So maybe you can correct me if I'm going wrong. So if I talk about dentistry per se, so you will see that every other postgraduate thesis revolves around saliva. Uh, the choice of saliva is because as we all know, why the reasons. I mean, what would be the reasons? But the only problem that I feel is most of the dental studies done here, particularly uh, at the educational level, are running on a cut paste mode with minor variations. So, well, but for this, I never blame the faculty or the student. I feel more exposure to the field is necessary because with my recent endeavors, which I have seen that many people are not aware of what they can do with saliva. So I think awareness has to be built up. And also, as just taking a trail of the words that Professor Paul just now said, that maybe dentists would be more interested if they understand that, like there is a clinical application value for this. So that in that line, I would like to add that that academic research through saliva can also lead to entrepreneurship or to novel innovations. Yes, is yet to be understood, at least by the Indian dental community, to be very straight and blatant. So I think through proper awareness and exposure to the field, I strongly believe that dental professionals are the closest persons to saliva, and each one of them can revolutionize science. So that is how I can answer your question.
Yeah, ma'am. Dr. Paul, how good does saliva hold in terms of cancer research?
So this is a subject that's pretty dear to my heart, if you like. You know, through collaborations with other researchers in the cancer field, I see a great future in saliva for cancer diagnosis. And the example that I'll give you firstly is one that I think Dr. Gargi Roy is aware of. Certainly, Dr. Marin's worked with Dr. Wong before, but David has done exciting research in saliva. He's my mentor for many years, and I really respect the work that he's done. But over the course of the years, he's shown that if you can collect a cell-free sample from saliva, you can use that cell-free sample to diagnose diseases like lung cancer, prostate cancer. I believe he's looking at breast cancer and other cancers as well. But just recently, he published a couple of papers which are very exciting, which show that if you take one drop of saliva and you put it on his instrument, which he calls EFIRM, which stands for Electric Field Induced Release and Measurement. And this is a technology which is non-PCR. It is actually agnostic. It can do DNA, RNA, or proteins. In this case, he's looking at either cell-free DNA or exosomes from the saliva. He takes a crude saliva specimen, if you like. He puts it on his machine. 30 minutes later, he can diagnose lung cancer. He looks at two mutations in the EGFR gene, which are the exon 19 deletion and the L858R. And what he found was that the correlation between saliva and tissue is obviously the gold standard for cancer diagnosis, is actually better than the correlation between plasma and tissue or blood and tissue. So in this case, saliva is actually a better medium for testing for cancer. And that's just the tip of the iceberg. You know, if you can identify cell-free DNA or exosomal fractions from saliva, they're going to be useful in other forms of cancer as well. It's just at this point, we haven't looked at the specific biomarkers that can be useful. But David's work was done in conjunction with the National Cancer Institute. So they're very interested in saliva now as well, which I think will help, move the field forward a little bit.
Thank you for sharing these wonderful researches with us. And coming back to you, Dr. Gargi, ma'am, as you mentioned that we are somewhere lagging behind in the field of research, especially in the field of saliva. So ma'am, would you like to tell us the three most important things that should be considered when we plan any research as a dental student or a young researcher in this field?
Okay, Udita, that's a good question. But I would like to modify your question and tell that what three things a dental student or professional must ask themselves to go ahead with saliva. By ask, I mean A for attitude. So a holistic attitude or a perspective to see a dental pathology can be developed or not. So this should be the first question I should ask myself, that do I really have a attitude, a holistic approach can I take, or can I see a dental pathology with a more broader view? So if this answer is yes, then the next question is S, that is skills. So my question that I would like to ask myself is, okay, I have the attitude. Now what to do with that attitude? To explore more, I need skills. So do I have the mindset to grab these skills or rather technologies that are being developed, or am I aware which is required to go ahead with the field? And if again this answer is like no, I really don't have the skills much, so it's the K, that is knowledge. So then I'll definitely ask myself, okay, where and how do I learn those things? So I think these are the three things that has to be asked to oneself before, whether you're a faculty, whether you're a student, or whether you're a young researcher, even whether you are a researcher who have been doing, who have been in the oral healthcare research for long. Anybody can start saliva, take up saliva and start research at any point of time, particularly pertaining to dentistry. I would just end with this to answer your question with that.
This mnemonic will surely bring worth research, which is worth doing. So as we are living in a life of turbulence because of this global pandemic, so I would like to ask our subject experts, how important is the role of saliva in the present scenario?
I think I should take that one, Jill. And I just remembered the name of the researcher in Las Vegas. His name is Ebersole, Jeff Ebersole. So if you want to, Ebersole, if you wanted to look him up, he's working in the periodontal field. So anyway, in terms of the COVID-19 epidemic, the way that the situation unfolded was there was everybody was using nasopharyngeal swabs to actually collect a specimen, whereby they have to insert the swab about 6 inches into your nasal cavity, collect the specimen that way. It's very uncomfortable. It can be painful. It can lead to blood and other things. So there was a vast shortage of swabs around about March, April time. So there was a worldwide shortage of swabs. And at that point in time, that's when saliva really started to kick in. People started to look at saliva for testing for COVID. And, you know, over the course of 5 months, maybe from maybe 6 months, I think I had in my library 2 papers that looked at saliva and COVID-19 testing. I now have at least 100 papers, and every day there's more and more publications coming out. So that might just be the tip of the iceberg. But what we found is many companies developing either antibody tests, antigen tests, real-time PCR tests, next generation sequencing tests, other point of care devices that can detect COVID-19 in saliva specimens. And you know, some of these are the very large companies, you know, like Abbott, Thermo Fisher. All of these big companies are jumping into this business. And you've probably seen in the literature and in the news, several companies got FDA clearance to actually market saliva tests. The first one that got through the system was the Rutgers test, which is a friend of mine, Andy Brooks, in Rutgers in New York. They were very lucky, actually, because they got through the system before the FDA changed the guidelines. But at that time, you literally had to do what I would call contrived specimens rather than real specimens. You could look at spiked specimens in a laboratory, get the data and send that data into the US FDA and get an approval to begin testing people with that particular kit. And they're now up to, I think, about 100,000 tests per day. It's a very large volume that they're preparing. There's another company called Curative that reckons they've done already 7 million tests using saliva as well. So it's becoming more and more important. But just recently, a Yale group got a test through the system called Saliva Direct, which uses just a spit in the cup technique to actually collect saliva. And that got a lot of press, but it also precipitated more interest in saliva. We provide collection tools for saliva. All of those are in validation right now at multiple sites around the US. And the potential for testing is so great that there is room for many companies to be out there with their tests for COVID. So the other thing that really has slowed some companies down that were going through the process is the fact that the FDA changed the goalposts, if you like, and asked companies, instead of using contrived specimens, they now have to collect at least 30 specimens with a swab and also using saliva and compare the results of the two side by side. What we're seeing from those is that the results are highly comparable. In some cases, saliva is better than a swab. In some cases, a swab is better than saliva. It just depends on who's actually doing the test. But the numbers are actually outrageous. They're out of the ballpark. You wouldn't believe how many tests are needed to be done, but they're in the tens of millions, maybe even hundreds of millions. So yeah, saliva is growing and in interest in the COVID area.
Thank you. Dr. Jalmam, will you please enlighten us on this topic?
Yes. For me, one of the challenges has been our newborns or fetuses actually exposed to the virus in utero, and this remains still a mystery, where some reports coming out that they are and some are not. And we've mentioned leaders in the fields of salivary diagnostics, and I will throw out another name we haven't mentioned, which is that of Dr. David Walt, who currently is at the Weiss Institute at Harvard. And I've been fortunate in my career to partner with both Davids, David Wong and Dr. David Walt. And David Walt and I have a proposal in that we hope will receive funding, where he's developed and adapted his assay, which is called Simoa. It's a single molecule array for COVID antibody testing. And what we've proposed to do is babies who were born to mothers infected throughout gestation, not just at time of delivery, to do a comprehensive antibody profiling to COVID based on saliva. So we know that IgA certainly is detectable in saliva, as well as IgG and IgM. And our hope is that when babies are born, even if the mothers were infected in the first trimester, we could assess their antibody profiles to see if they were exposed and then correlate that exposure to outcome, COVID remains a big challenge in the maternal infant field. We certainly know viruses like the Zika virus, cytomegalovirus, parvovirus, their impact on a fetus can actually vary and when the infection occurred in gestation. And we know nothing right now as if an infection early on during embryology or in the second trimester may have impacted the baby. So I think over the next few months, there'll be a lot of emerging data if we know factors that may have contributed to the virus passing into the fetus across the placenta, the immune response of the fetus to that virus, and any complications. So please stay tuned for that, because in my field, this remains an enormous question mark. And of course, all these women will soon be delivering who may have been infected earlier in the spring when the pandemic hit. But I have my fingers crossed that NIH will be favorable to this grant, but we shall see. We shall see.
I wish you luck.
Thank
You
you.
should get funded for that. It's really important work.
Yes,
Yeah.
fascinating, fascinating.
What I think doesn't mean what NIH thinks, but we'll see.
Thank you
Keep our
both
fingers
of you
crossed.
for updating us with the recent updates in this field. Dr. Gargi ma'am, few members in the audience wish to ask, are there any opportunities in the terms of career and entrepreneurship with saliva in India?
Yes, that's a very good question. And well, I will take a little time to answer this. So I personally believe that we are the ones who create and recreate a career path. For the first thing that I just want to answer that. And entrepreneurship, yes, very much. In that way, if you see, every dental graduate is an entrepreneur by virtue, particularly who set up a dental clinic and serve the society and they've been into the dental business. With saliva, today, what I planned is that, or maybe I can just sum up one point as a food for thought today for the 9 branches of dentistry with which that can be explored with saliva. So first is oral medicine, your field, Vita. That's the field where is most important that deals with diagnosis. So definitely saliva here can play a very vital role in disease diagnosis as well as risk prediction. So second is I will merge two departments here, that is orthodontics and maxillofacial surgery. So this one point that I can say in this is that comes to my mind is craniofacial and developmental disorders, syndromes. Even saliva can be used for prenatal predictions, particularly if you see salivary microRNAs. Huge work has been done, and I think it's a very fantastic field to be still explored, where with salivary microRNAs, you can actually understand the craniofacial deformity patterns, or you can even predict, okay? And fourth one is the periodontics. Well, most widely researched area in perspective with dentistry and saliva. So as already Professor Paul was mentioning that, commercial tests are available in the global perspective. And also when we talk about oral systemic link, like, how the microbes are that are found in the mouth also are responsible for many systemic diseases. So in those cases also saliva is a very good medium to be studied. Endodontics, sorry. So again here, mostly, we could come up today with so much of information about oral microbiome through saliva about non-cultivable ones. So if there wouldn't have been saliva, then we would only be sticking to that culturable one. So in that way, those microorganisms which we thought, would be the main pioneers for causing dental caries, now that scenario is changing, right? So public health dentistry, that is another branch, which where you can do very good epidemiological studies, population studies, and saliva. I hope you know very well that how saliva can be easy as come if I'm doing a public health or population study. Pediatric dentistry, well, here whenever it comes to pediatrics, it's about caries. So early childhood caries, or we can do caries risk assessment, as already ma'am and sir already enlightened us in this. And So where do we go with this? So if we have a case risk assessment test, or if we can develop such as, then it leads us to something called as minimally invasive dentistry, which is the need of the hour, even if you see in the pandemic situation. And prosthodontics is where we can understand the causes of implant failure by searching or salivary biomarkers. Even if you see, Udita, like there is a different pattern of bone loss which differs from person to person, right? So some people, particularly when I'm talking about in perspective of geriatric dentistry, so you can understand bone loss pattern with salivary biomarkers, and then definitely it leads you to something called as nutrigenomics, and there we talk about saliva and taking out DNA and understanding what kind of diet should be prescribed. So I think I have summed it up, and there is a whole lot to do in dentistry.
Really, ma'am. So I understand that the initial steps are usually the hardest. So may I request the guest speakers to kindly share with us what was the inspiration behind initiating this global science meet on saliva?
This has to be yours, Jill. You're the brainstorm behind this.
Yeah, but he's Dr. Paul is my big partner. So for me, you can imagine, and I think we've talked a lot about this, the dentists really know the most about saliva. So here I was as a neonatologist, a patient population that didn't even have teeth, was not on any dental radar, and I was trying to become a salivary expert. And I would go to my pediatric meetings and they would not understand what I was doing in saliva. And the dentist had no idea what I was talking about. So I expressed my frustration to Paul over a breakfast or lunch meeting we were having. He was visiting me in Boston. And I said, Paul, I have no home. I don't know where to go. I need to learn more. I want to be with a group of individuals who have an excitement about saliva and are knowledgeable, but I'm lost. I'm on an island. And without missing a beat, Paul said, well, we're going to do it. And I said, we are? And he said, yes, we are. And off we went. But it was really, and Dr. Gargis has done this as well, it's just, and she's talked about that entrepreneurship and that willingness and the drive, and that's what it takes, because we are a community that wants to help, wants to work together, wants to move this science forward, but we're not a huge community. So we need to have opportunities where we get together and share what we've learned, what's worked, what hasn't worked, what our struggles are, where the field is going. And I'm proud to say and happy to say, since I've started, and Paul, please speak to this as well, how far we have come, how far we've come.
Yeah.
We have a long way to go. But
Yeah.
it is amazing if I even reflect back 10 years from, now when I say I study saliva, and I think a lot of this is due to 23andMe and Ancestry. Even the lay people understand it because they can spit in a tube and send away and find out their genetic risks, who their relatives are, and where they came from. And that was all in saliva. And I can't tell you what that did for us globally, because now people said, oh, I know I can spit in saliva and get all that information. So what can you get? But again, we have to continue the work in a very thoughtful way and understand the science that we're utilizing to continue to move it forward. But that was my impetus, and I was so fortunate to have Paul, who has partnered and really taking over. It should be called Paul's NAS now. But
Paul and Chris. Chris
really,
helps a lot.
You couldn't ask for a better partner.
Right. Paul and Chris.
Yeah,
Chris
Paul and
helps
Chris, that's right.
yeah. So, my perspective, I remember I would go to the European meetings, and they would have European meetings for saliva, and it's called the European Saliva Symposium, but they only had it every 3 years. So, when you went to a meeting, you had to wait another 3 years before you get your fix of saliva again. So, when Jill said, why don't we do this? I snapped at the chance. I said, yeah, we got to do this. We got to do this. Now we've had 3 in Australia, 1 in China. It'll be our 3rd in India coming up soon. And we were talking, Jill, about Brazil and South Africa in the next 12 months if COVID hadn't come along. So yeah, it's come a long way. And I think Jill's right. 23andMe claims to have 6 million customers right now, and Ancestry's done 15 million tests, collections, if you like. So they're the guys that really drove this market forward. And all of a sudden, not just us are involved in this area. A lot of other researchers see the need or the potential for saliva, and they've obviously gone off looking for salivary biomarkers as well. So it's kind of a self-sustaining thing. Now I think we've got a snowball that's rolling down the hill. We just got to keep pushing it, and it's going to go. That's my opinion anyway. Thanks, Jill. Thanks for providing me with the spark.
No, thank you, Paul. Best partner ever.
Today, I have really understood the meaning of the saying, where there is a will, there is a way. Thank you for sharing your story of success with us. Gagi ma'am, may I ask your kind self to share what was the inspiration and the challenges you faced when you initiated this global meet on saliva here in India?
Okay, so first I will talk about inspiration. There were many inspirations. First inspiration was to bridge the gap of knowledge, which I realized since I have studied both way. Like I have been studying genetics, and after completing that, I did dentistry. So after doing that, I understood that there is a huge gap of knowledge, whatever be the reason. Inspiration was to promote interdisciplinary science. My inspiration was to promote importance of collaborative research, because as Udita, today all of we are hearing from Dr. Paul and Dr. Jill ma'am. You can well understand that what challenges they have been facing, and this is actually nothing but then how inspiration can take things forward. And another inspiration, definitely, which if I don't tell it, then it would be very wrong, is that was my mentors, which whom I have been following years together, and today I'm honored that I am lucky to be their collaborator. And challenges, yes, many challenges. First one challenge which I faced when I thought of doing saliva symposium, when I could get Professor Paul's nod of yes, we can do it in India. So first one was lack of awareness among the dental community about the wonders of of the salivary science, because my first direct approach was focused to the dental fraternity. And I also faced and dealt away with unfruitful collaborations on both national and international levels, as well as individual and institutional levels. But I have learned a lot from my mistakes. And also I had to tune in with my depression and adapt emotionally, because many a times I thought, or I felt that okay, I'm not in the right track, maybe this is not the right way I should do it, I should quit. But now at this present time, I always thank God for giving me those challenges, because I think those were eye openers for me, and I don't call them as challenges or mistakes, but those were opportunities. And in my journey with saliva in India and Halsey, apart from my family and friends, one person without whom I could not have been able to do anything. And mark my words, it's really, really true. With establishing saliva or SALSI in India is Professor Paul. It is not that I'm telling because he's sitting right in front of me, but it is the truth, because he has literally taught me how to put each small step and make a mark. So that is one thing which I cherish, and it is a very great honor for me that today I am able to do at least something fruitful, where I get an opportunity to share the same platform where such pioneers are talking, and I can also share my views. That's an honor and privilege for me.
No, but to be fair, you are a very good student, and you've learned very, very rapidly about salivary diagnostics, and you've basically put your expertise, in the Indian area, and you've developed a lot of relationships in a very, very short space of time based on your, one thing that I think is phenomenal about you, Dr. Gargi, is your ability to use the social media to get the message out. I'm still trying to figure out how to use Twitter and Facebook and all these other things, but you're amazing. I just wish I could learn from you on that. But let me say one thing about NAS and SALSI, because I think it's very important. And there was never meant to be a commercial aspect to the meeting. The idea of the meeting, and still remains my goal and Dr. Marin's goal, is to bring together the commercial companies that are developing new technologies. Maybe it's Saliva, maybe it's not. We've had Thermo Fisher there and groups like that. With the researchers that are developing the next generation of biomarkers, put the two in the same room, get them to collaborate to generate the next generation of tools that will help people. And I think Dr. Marin will tell you, we've invited all of the big players in saliva, like Salimetrics, like OraSure, DNA Genotech, 23andMe. None of them, aspire to come. They don't want to attend a meeting like this, which is a shame, because I think they could be very valuable in getting the message out about saliva. And it's not a competitive situation. We are all working together to develop new diagnostics that will help people. At the end of the day, that's what it's all about. And there's a lot of room for all of us. So, if we can all work together to get all of our, friends together, like 23andMe and Ancestry, let's work together to get them there, I think.
Absolutely. Absolutely. Without collaboration, I don't think science moves forward.
It doesn't move forward. No, you're absolutely correct. Yeah.
Ma'am, what's in the bucket list? What's in the pipeline for next year?
Okay, so I think Udita, you can do the due honor, and we can proceed with what is the most important and very fascinating for us.
Yeah.
Uh-oh.
I now earnestly request the Excellencies to please unveil the website of Saliva Symposium 2021.
I would request, am I audible? Yeah. I'd request Dr. Paul and Dr. Jill to announce the International Saliva Summit of India 21 as of it, and to inaugurate this website or platform for the time being.
Jill, I'm going to let you start. I'm going to let you start on that one.
Yeah, we're just very excited to be able to share this moment with Dr. Gargi, who's worked so hard putting this together, but there will be a remote virtual SALSI 2021 this coming January. And I think both Dr. Slowy and myself will be participating virtually, along with what I'm sure will be an amazing lineup of speakers that will be contributing, so that despite the challenges we face with COVID-19, we will continue to push the field forward. So I'm excited to be here today and be a part of the announcement, and look very much forward to the end of January 2021, where we can gather once again to discuss saliva and its benefits.
Thank you so much, ma'am.
Yeah, this will be the third one. We're already into number 3, which is fantastic,
Yeah, and I think it speaks to what Paul is saying about you, Dr. Gargi, that just how devoted, determined, organized, committed you are to this, and we're thankful for that.
Thank you so much, ma'am. It means a lot. It means a lot.
I think you'll see a very big turnout this year. I think, the work that you've done, not just in the research field, but also on the commercial side, is, to get people interested in using saliva. I think that's going to stand you in very good stead. You're going to see a much bigger and broader, attendance this year, and we'll help with the list of attendees and speakers as well. I have a couple of other ideas I haven't shared with you yet.
I will say I will miss the food though, because the food you had for us last year was amazing, and it will not be the same, but
But this year we will be, I mean, 21 will be missing, but I'm sure once this pandemic is over, we will compensate for what all we will be missing in 21.
Well, I'm going to miss Jolly and Deborah as well as you.
Thank you, sir, ma'am. We are really fortunate to have your gracious presence at this auspicious moment.
You're welcome.
So here's the first poster of Saliva Symposium 2021.
Very good.
So this is about Saliva Symposium 2021 with the theme of from lab bench to chairside. And this is the website www.salsi.in. And the dates are from 29th of January to 31st of January 2021. And the organizing committee behind this event has been toiling really hard to bring to you the galaxy of globally renowned speakers. So we have on board till now, we have Dr. Paul with us. He is from USA. Dr. Jill Marin ma'am from USA. Then Dr. Sonia from Australia. Dr. Basin from UK. Dr. Deobora from Brazil. Dr. Tilak Ratne from Malaysia. Dr. Manugri Chetty from South Africa. Then we have some national keynote speakers also. So to name the few are Dr. Gargi Roy Goswami, Dr. Sriram Raghavan, and Dr. Anirban Chatterjee, sir. So we hope to see all of you with us for this event.
Thank you, Dita.
Welcome, ma'am. So with this, we extend our heartfelt thanks to Dr. Paul for being with us, for gracing the occasion with his esteemed presence. So this is a small token of honor and appreciation from the entire family of Indian Academy for Clinical and Dental Genetics, sir. Please accept this.
I do. Thank you so much. I am very honored and appreciate your thoughts and kind wishes. And this certificate is is special. It means a lot to me. So thank you so much.
Thank you once again, sir. We also feel immensely happy to present this token of appreciation and honor to Dr. Jill L. Marin, ma'am. Thank you, ma'am, for enlightening us with your valuable insights on this topic and for being with us throughout the length of the session.
No, thank you both so much. It really is my pleasure. I have appreciated the opportunity to speak to everyone today. So thank you.
Thank you. Thank you so much. Thank you for your time.
So now in the end, I thank all the participants for registering for the course. Your enthusiasm and passion in learning is a driving force for us to organize many more events in future also. And I would also like to extend thanks to all the audience, as without your support, no show can ever be successful. And thank you once again. Hope we were able to deliver as per your expectations. And any criticism or feedback can be directed to any of these contact options given on the slide. And the certificates of participation will be mailed to your registered emails within a span of 7 to 10 days. So please be patient and be with us. So thank you once again and good night all.
Good night. Thank you.
Thank you.
Good night. Thank you so much. Thank you for
Bye.
allowing us to be part. Bye-bye, Dr.
Bye.
Gargi.
Bye.